Blood sugar control is one of the most important yet misunderstood aspects of health. Your body works constantly to keep blood sugar around 100 milligrams per deciliter, whether you're eating or fasting. When it gets too high, it's called hyperglycemia, diabetes. When it's too low, hypoglycemia. Two organs manage this balance, the pancreas and the liver. After eating, the pancreas releases insulin to pull sugar from the blood and store it, while the liver releases stored sugar when you're not eating, even converting fat to sugar if needed. However, as long as sugar is present, your body won't burn fat. The body stores sugar as glycogen in the liver and muscles, but storing sugar requires potassium. Without enough potassium, you can't store sugar effectively, leading to cravings and weight gain. Adults need about 4,700 milligrams of potassium daily, best obtained from vegetables. Type 2 diabetes is largely caused by insulin resistance, often due to excessive sugar intake that overwhelms the liver. Type 1 diabetes is more severe, as the pancreas stops producing insulin. The average person consumes over 140 pounds of sugar per year, straining both the liver and pancreas. The liver plays a far bigger role in blood sugar regulation than most realize, doing nearly 100 times more work than insulin. Improving liver function even slightly can dramatically reduce stress on the pancreas. Cutting processed sugar, eating nutrient-rich vegetables, and focusing on liver health are crucial for restoring balance. Growth hormone, which declines with age, also supports blood sugar control, fat burning, and muscle preservation. To boost it naturally, get quality sleep, try interval training, and eat liver-healing foods like kale. By supporting your liver, increasing potassium, and avoiding sugar overload, you can stabilize blood sugar, burn fat, reduce cravings, and protect long-term health.